Hello, everyone. Welcome back to BioNexus Health podcast series, Autism Uprooted. It's wonderful to have you back. Please remember to subscribe. Looks like 57% of those watching and benefiting from the videos are not subscribers. So please go ahead and do that. It helps us take our message to a much wider audience. All right, so let's proceed to today's guest. Today, we have an update for you. This is Benazir from Pakistan. She is going to be updating us about her son's fantastic progress since we last spoke. So let's go ahead and welcome Benny, to the show.
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Benazir, hello, how are you doing today?
Great, how are you?
I'm doing well, thank you. Thank you, yes. So it's, it's kind of early for me here. It's only 8 o'clock in the morning, but I'm usually up between like 3:30 and 4 a.m. in the morning anyways. So no worries. I'm glad you could make it.
Yeah, it's 5 o'clock evening at our side. So
okay.
Great pleasure to have you here. Thank you.
Good. So we shall be discussing about your son's further progress since last we spoke, and so I'll just let you take it away and tell us how he's doing.
Yeah, he's doing great, I must say. Last time when we talked, Hamza was showing signs in improvement in speech, you remember, because it never happened to us before that. So it was a great achievement at that time as well, that Hamza from very start showed signs of speech, at least in terms of expression and non-verbal gestures. There are a lot of elements in speech itself as well. So I would say it was great. And it was great at that time as well. And there comes times when we see sometimes that a child is maybe showing us a plateau phase, we call it, when the child is neither regressing nor improving. Such times also come. Sometimes there are exposures, and obviously with a little brainstorming, we can come up to the conclusion that, okay, this happened, and then it was a result of that exposure that the child is going through a flare. Such incidents kept happening, but let me tell you one thing. For example, a great achievement in these days, since we talked last time, Hamza's flares are no longer that intense.
Flare-ups, you mean? Flare-ups.
Yeah,
okay.
Flare-ups, I cannot recognize it very clearly.
Okay.
For example, he doesn't regress that much anymore. Like it never happened that he completely became a silent child. No, not any longer. Plus, because we started his interaction with the outer world as well. First, we were keeping him at home at that time when we spoke. But now we take him out, for example, for tennis, for equine therapy, the horse riding therapy. And
yes.
Recently we gave a trial for music therapy as well. Everywhere he was responding to the instructors, whether he was looking at them for the first time or he was meeting like this. I can say that every time he's making much more improvement in terms of talking and expressing his feelings with the others. Even he sometimes, for example, let me give you an example to show. For example, when he's playing tennis, I can clearly see that his ball goes to the other side of the court. He wasn't able to do this initially, as we are suffering from Lyme as well, and we are recovering. Yes. I can see from my eyes that he is recovering because he is using his body much better than before. His immune issues have improved. He now have started getting a little fever whenever he gets ill.
That's great. Oh, that's good to hear. Yes, fevers are a good thing.
Yeah, exactly. For example, last time he had a little tummy upset. and he got fever along with that. It was a mild fever, not very high fever, but at least his immune response was responding, and he had fever for a couple of days and then he recovered. So I was happy that he was able to fight off whatever happened, and I didn't use any antibiotics for this, and he was able to recover naturally. Yeah, beautifully, I must say.
Oh, okay. You know what? If I may, right? Let me, because you're talking about so many the different improvements. So if I may just specify a little bit. So you're saying that, which is quite natural, that, he's going through some re-exposures. And because of the re-exposures, right, it happens to everyone. So he's going through re-exposures now that he's not mostly at home, now that he's showing an interest in going out there, meeting people, trying sports. And with the exposures you mentioned, he's getting flare-ups, which again happens. Now, with these flare-ups, you're seeing no regression right now because he's on the protocol, and whatever exposure he's getting, the protocol is able to absorb that exposure. That's great, because sometimes due to various, various circumstances, the exposure will exceed what the protocol can do, because we have to put the child on a pediatric protocol. I cannot put him on, like, 100 milligrams of charcoal 5 times a day, which is something that an adult would be able to do. Good. So that's really good. So the fact that is happening is that the reason for that is that his immune response has improved, and I'll see this a lot on herbal treatments, that whatever improvements you see, they are usually deep within the improvements, so they are maintained like forever. I mean, the improvements that I've seen with all of my patients, of course, Brian as well, those don't change. You might see a little ups and downs, but once the gain has been made, it stays. So that's done. Now he has higher motor coordination. So he's playing tennis, he's showing an interest. Last time you mentioned, he had started riding his bicycle really well. He seems stronger.
Exactly. And it was sorry, I'm interrupting, but we never trained him for that. He just started doing it, like he wanted to do it. Now we are having a small cycle inside our house as well, which can be used within the house, of course. And he enjoys that. He rides it as well. And one thing that I didn't mention clearly earlier is that the improvement in speech. Now he is even trying to use a proper sentence. For example, initially he wasn't using, for example, the with a thing like the apple. He wasn't finding it necessary to say the apple in the fridge, for example. Or sometimes he used to say, child, wear his shirt, like that. He wasn't using his, her with the within the sentences. Now he is trying. He struggles for that. I can see that looking at his face, that he's trying. Then he's correcting himself, going back again, then starting the sentence again. But he's trying, and he is trying to put everything in place properly. That he tries several times in a day, and that's really satisfying. I'm very, very happy over that. So ups and downs is happening, but he's improving. That I can see.
So his language.
And remember, we tested his immune markers as well in the April.
Okay.
And you saw that immunity markers were improving in the report as well. So he's showing signs of improvement in every area. Some areas are far better than other, but everything is complementing each other, and we can see that the child is certainly reviving from the old condition. That's really satisfying.
Wonderful. The question for you is, do you see that his language is spontaneous, right? He is, you said, he has started to use prepositions and what have you, and adjectives. So
Yeah.
this is spontaneous, right? It's not on demand. It's not
Yeah.
because you're asking him to do. He just wants to communicate.
Yeah. This is very important point that usually we had to ask him, Hamza, what is this? What is this? Now he tells him, sometimes it happens that we are going somewhere, we are somewhere in the office and we are concentrating, talking to others, but he will try to grab our attention. Mama, mama, look, pen under the table. Oh, so he tries to.
Oh, that's awesome.
Yes, the point, your point certainly, that he wants to talk to us, he wants to share something. Yeah, this is spontaneous, definitely. I would say this is spontaneous. He talks, he tries to talk wherever he is. And plus one more thing, any other thing I try with your protocol, it gives 100% results. Sometimes there are places where we go, a number of children are coming there. For example, the TANAS, equine therapy, everywhere, he is showing much better results as compared to other. So I would say that doing the treatment along with other things certainly boosts the effort you are putting in.
Oh, yes.
And even the therapists, the other people say that Hamza's improvement is better than others. And that shows that the brain is reviving, it's reconstructing, regenerating itself, and the inflammation is going down. It's a sign of success of the protocol.
Yes,
Definitely.
yes, absolutely. Yes. In fact, this year at Autism One, Autism One is the largest autism conference in the world. So as usual, I have a couple lectures, and one of the lectures that they've asked me to speak on is that what is the correct order of treatment? How do you prioritize what to treat first? So you make an important point, Benazir, that now that the underlying issues are being addressed, some have been addressed. He's been on the protocol. It's like peeling off an onion, right? One layer at a time, little by little, you proceed. And it might be slow and steady, but it's better than thinking that, oh, you know what, we have an autism spectrum disorder diagnosis and that's it. There's no cure, there's no hope, no nothing. So slow progress, consistent progress, is the key. And this happens if you treat in the right order. So now that we have gone through so many different steps with Hamza, any other ancillary treatments, complementary treatments that he's going to be taking, you said equine therapy or hippotherapy. He's responding well, which is great, because his visual motor, his body awareness, okay, his sometimes because of bone conduction, which goes through in hippotherapy, right? Sometimes auditory sensory processing also gets better. And one of the biggest things that improves is proprioceptive. So all of these, make a person more comfortable in their body. And when they're more comfortable in their body, that's when you'll see language coming out more. You'll see academically, right? How's he doing academically?
Everything. I don't have to struggle a lot like I had to before the treatment. He understands a lot of things, and a few other things I would second,
Sure.
just as you said.
Yeah, sure.
He can do a lot of things without training. Like he is able to use the the remotes, the functions of every button. We never trained him for that as well. For example, how to skip a chapter and how to go faster. For example, we never trained him. He is exploring each and everything of the house. My house is a mess at the moment, and we are just leaving it to him that, okay, explore everything and then we'll clean up. because he is getting to every corner, every carton, every box, and he's just pulling out things, plugging in, seeing what everything is doing. And it amazes me when he tries to put on the, headphones, he tries to put on the radio. And we never trained him for this, he's able to, because he wasn't doing all this before the treatment. He wasn't that kind of a child that was aware of his environment. What is this? What is that? He wasn't curious at all that way. And secondly, he does a lot of mischievous activities. For example, it's his routine now to hide his father's mobile. And then he comes back and says, "Where's the mobile?" And then he forces his father to go get it. Where's the mobile? And he has to go, he has to look for it. And sometimes he turns off and throws it somewhere, and it becomes really tricky to get it back. And initially we had to struggle a lot with a lot of things. For example, now if he hides mobile and we ask him to give me the mobile, or we won't go to the playground or something like this, he goes back and gets the mobile, brings it back. Initially he never used to fulfill such kind of demands as well. So we are a lot happier because he can do mischiefs as well. He's a happy child now. He mostly laughs, smiles, reciprocate every smile, and he interacts with us and other guys as well, our maids and everything. So it makes me a lot happier. Should I close my window? I think it's the voice must be interrupting.
No. It's fine. It's fine. It's your prayer starting. Yeah. Oh, God bless. God bless. Well, this is so heartwarming to hear, because you have been so steadfast. I mean, you've been very positive. You have sacrificed a lot for your child. You've put yourself aside. It hasn't been about you. It's been about Hamza. And look at the results you're getting. You have a very scientific mind, don't you? Because you've understood flare-ups, you've understood die-off reactions, everything that I've explained to you, about how the immune system responds and how it is a slow and steady process.
Yeah. This is the main point where I see a lot of parents misunderstand this very crucial concept, I believe. Look, there is a lot of damage involved, and there are multiple damages involved. Two things, like
exactly
the gravity of the situation, where brain is affected, where gut is affected, where organs are under stress.
Yes.
How can everything come in place within days? It's not possible. And sometimes we'll be focusing more on gut, and then we'll be focusing on the rest of the things, and a lot of things have to become better.
Right.
It's a lot of effort, and definitely it involves ups and downs, and a lot of people just misunderstand this thing and give up very early in their journey. That's very unfortunate. I pray that God help every child and recover every other child. But I think it's a very crucial point that the parents understand that it will take time, and it is the brain we are working on, it is the immune system we are working on. And it will definitely take time. And in this long duration, we will see ups and downs, because everything is not in our control. Sometimes mishaps happen, sometimes exposures happen. So all of this have to go together.
Yes.
And it takes time, but it gets better.
Yes. You make a very important point that, I wish every parent would understand, so they don't do, what's called as doctor hopping. Like you go from, one treatment to another, one practitioner to another, like within the span of 6 months, within the span of a year. But that's not, it's very interesting that when you start seeing progress, many parents just become very impatient. So it's it's a very important point that you mentioned. Exactly, the damage is vast. You can't just go from one day uh, getting the diagnosis of autism and getting it's a tremendous shock to everyone in the family when a child gets diagnosed. So you can't go from a life sentence to suddenly within a few months, you have a child who has most of his symptoms are gone. Doesn't really work like that. As a disease, as a syndrome, autism itself would usually progresses. Now, for us to go in and try to, as much as we can, try to look at the underlying issues, if there are any medical issues. In my practice, 100% of the time there are issues. I understand that there are no absolutes, but fortunately in my practice, 100% of the time I have seen children on the spectrum have so many underlying issues, like you mentioned. There is brain damage, there is gut issues, there is organ stress, there is a heavy load of different kinds of toxins. And, on a small body of a child, it's not possible to address all of these together. It's not like you can put heavy duty detoxification intravenous drip for a week and boom, the body is clear. It doesn't work like that. There are exposures. That's the thing, it's just, I've actually sadly heard from many parents, and they've sent me photos. Some of them have traveled abroad, and abroad, I guess is relative because you are abroad right now for me, but, many have traveled out of country, let me put it that way, to receive invasive treatments for their children, intravenous, intrathecal, FMT, lots of antibiotics, vancomycin, completely wiping everything out in the gut, like prepping for additional treatments. Every parent, I'm sure, researches, they want what is best for their child. So hats off to that. But what I've seen is that many of these facilities, the environmental conditions are not ideal. So that's the problem. If you are patient and stay at home, or where you are, and be patient and wait for the protocol to go step by step. Scientific research, in fact, Dr. Shoemaker's research clearly shows that treating mycotoxins is a 12-step protocol. World-renowned infectious disease doctors have, and immunologists, have commented that PANS, PANDAS, Lyme disease co-infections is typically anywhere from 4 to 7-step protocol, in addition to the mold protocol. Takes time. So don't lose patience.
Yeah, exactly. You cannot have the results in second, third phase, which you want, which are supposed to happen after 10, 12 phases, definitely. And there are minor changes. I usually ask mothers, because sometimes the father says, we have a couple of fathers as well in our community. Okay. And sometimes they say that we are not seeing any major change. I say major change is not that important. What minor changes are you looking? Right. Are there any minor changes as well? And usually I have to say, please let me talk to the mother, because she can observe on daily basis. Even a single word, a single gesture, mother sometimes notice a child, a minor change in the child, that I must say. So the changes are usually very minor sometimes, but these are a sign of hope that what a child cannot do earlier, he's doing now. It means the things are working. Okay, sometimes people say things improve with time. That's the major thing we face. Sometimes people say, okay, yes, your child is improving, but maybe it's happening with time. So I usually say, where was that time before the protocol? Why wasn't I seeing any improvement before the protocol if it's happening only because of the time? So I believe things happen with time, but your effort is necessary. In terms of medical treatment, I totally believe autism is a medical issue. I must say it is a bodily disease. I must say it's not something that we say we are not treating. We are definitely treating something. We are going after infections. We are going after inflammation. We are going after immunity issues. And I must say, maybe everything is not going to be 100% at the end, but I want my child to be functional. He must be independent. He must be functional. He must be able to do maximum with on his own. That's the wish of every other parent, and that's what we are working for. We're not going to make it exactly like any other normal child. Our aim is to make him functional and 100%. To the maximum level we can. Yeah.
Yes, yes. Yeah, exactly. Yes. Good. I'm glad that you explained that so beautifully, because lack of patience is a big problem. Like for me, it took me, I had to crawl my way through seeing Brian get better. I mean, slower than crawling, because there was so much trial and error. There was nobody there to guide me. I mean, if my past me had my present me to guide me at that time, it would have been, my goodness, it would have been a completely different story. The amount of suffering, like 7.5 years of pain, like literal pain and suffering, and everything that Brian went through while we were learning from so many different doctors around the world, that we visited, because PANDAS was just beginning to be researched back then.
Yeah. Exactly. It's a blessing that we have people like you because we don't even have those resources, that stamina. And it's a blessing. I always say, I always make people realize that it's a blessing that we can have a Zoom meeting and we can discuss the things and we start seeing improvements. Because definitely at your time, it was very painstaking. And maybe at that time, if I were at that time, I think I would have collapsed because it requires steel nerves and guts to do all this. So hats off to you. You
Thank you.
was able to do it.
Thank you. It's God helps those who help themselves, and I think I received a lot of divine guidance. I think, I always say that my mom passed away a few years ago. We received a lot of blessings from her in heaven as well. So it was a joint effort.
Yeah, exactly. It is a joint effort. That's also an important point, especially I belong to a community where sometimes it is left to mother to decide. And she usually doesn't have those resources. She cannot decide independently, or if she decides, she has to struggle a lot. Whether she's doing it alone or something, she's left alone most of the time. That's why we see very few people struggling and working on their autistic children. This is very unfortunate. So it is a family issue, I believe, because if everyone is not going to put their effort when the child is young and you can do something for him, as he gets older, it becomes a problem for everyone in the family. Yes. So it's very better. It's much better if everyone realizes and works when it's much needed, when the child is young, and something can be done at that time.
Yes.
I wish that the community thinks that way.
Younger the better, yes, definitely. But recently I spoke to, I have many patients in the Middle East, but there's this family, mom, dad, and son in the Middle East, in Dubai. And the son is 27 years old, right? With autism all these years, absolutely brilliant mom and dad. They've tried everything, but once again, most probably it wasn't in the right order required, like little by little. Like I mentioned, mold is a 12-step protocol, and Lyme is anywhere from 4 to 7. So at the age of 27, the tremendous improvements that are being seen in this young man, he was able to come on Zoom smiling, communicating, oh, is that Dr. Dashore? And mom was so thrilled. And the biggest surprise of it all was that we know that there can be a tremendous growth delay, height, weight, everything, because of all of these toxins and infections and environmental pollution, toxins and whatnot. That was the issue with this guy as well, this young man, and he has grown. I think mom said 9 to 12 centimeters. He has grown at the age of 27. So I know it's fantastic. You can even imagine the amount of what do they say, potential energy that was stored inside this body that was not allowed to blossom because of all of the medical issues. And yes, he's 27, he was loaded. He was loaded up to here with, infections and toxins. Yeah. And we were able to run labs and identify those. He's doing really well. I have a 34-year-old autistic lady in California, and her 67-year-old mom still takes care of her, and she is improving. Her self-care, she's become independent. She had potty accidents all over, the whole, it was a lot of issues for this poor mother, who thought she would probably go to her grave, and what would happen to her daughter, which was already 67 years old. But this young lady is doing really well. She's improving. So yeah, you should never give up hope. And, doing a natural protocol usually works very well.
Thank you for joining part 1 on the BioNexus Health podcast. Join us next week for part 2. Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold, biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.